Percutaneous Topaz for the treatment of chronic plantar fascia, a new technique. This patient has suffered from chronic plantar fasciitis for more than 6 months and has failed all conservative care. The patient wishes to undergo a more aggressive surgical treatment to try to eliminate their chronic plantar fasciitis. Prior to the induction of intravenous anesthesia, we have mapped out the area of pain as described and felt by the patient. At this time, we are now mapping out the area where Topaz will be performed. Dots are made approximately 5 millimeters apart to fill up the entire area of pain for the area that will be treated. Once the mapping is complete, the patient is brought into the operating room and intravenous anesthesia is utilized. Local anesthesia is utilized with 0.5% Marcaine to block both deeply as well as superficially to make sure the medial calcaneal nerve is addressed. An ankle tourniquet is utilized to create hemostasis, and then a .062 K-wire is utilized to create percutaneous incisions by penetrating the skin and then taking the incision superficial to the level of the plantar fascia. The plantar fascia is not penetrated with this K-wire. Once all holes have been created, the Topaz wand is then introduced and the plantar fascia resistance is felt. At this time, the pedal is stepped on and the Topaz wand is brought through the plantar fascia, releasing the Topaz energy, and then an additional application of Topaz is utilized deep in the plantar fascia. For demonstration purposes, we are utilizing intraoperative X-ray to show you the level that is utilized to penetrate both the skin and the plantar fascia. This shows, first, the K-wire penetrating the skin and getting to the resistance of the plantar fascia, and then this is showing the Topaz wand getting the resistance of the plantar fascia and then penetrating the plantar fascia both through the plantar fascia and deeply, while stepping on the pedal to release the Topaz energy to stimulate the healing of the plantar fascia. This procedure is then performed through every hole that has been created by the K-wire. The patient will be able to return to normal activities of daily life as quickly as 2 days after surgery. They will find improved pain as quickly as 1 week after surgery, and typically healing takes 6 to 12 weeks. We have found that this procedure has offered quicker pain relief than releasing of the plantar fascia in a more typical fashion. Additionally, we have found less postoperative pain and complications that may be associated with the release of the plantar fascia, such as lateral column pain and nerve-related symptoms. Postoperatively, steri-strips are applied, followed by a bulky compressive bandage and a surgical shoe. 2 days after surgery, patients are instructed to remove their own bandages and return to athletic shoes and orthotics.